is not only about the function, it's about our perception, right? And for the qualitative finding, I would like to share with you the first theme, regaining a sense of mastery. By practicing yoga, now I'm more aware of my body and posture. I learn about the step for coordinating my body movement, and it worked well. This really helped to reduce the disease impact, and I feel much more in control now. And the second theme is that integrating the body and mind. Many exercises require continuous movements of one body. By contrast, yoga keeps your body still and requires paying attention to your mind. It's the sensation of your self-consciousness, the state of equanimity which I appreciate the most, and is shared by an old gentleman. And then, fostering openness and confidence. You can see the change reported by the patient. I used to hide at home and doing nothing after getting Parkinson's. Until I attend this program, it has been an enlightenment, and I feel like a completely different person. My old perception of muscle stiffness and incapability caused by PD has changed. Yoga has motivated me, and I have become physically capable of doing many things again. I used to feel as stiff as a bamboo, but now I am much more relaxed now. I'm happier. I have the confidence in learning new things which could possibly slow down the degeneration. It's all shared by the participants. To conclude, compared with conventional stretching and resistance training exercise, yoga shows additional benefit on psychological distress, spiritual well-being, quality of life, with comparable benefit related to motor symptoms and mobility. And yoga is an effective, safe, and appealing complementary lifestyle intervention for stress and symptoms management for people with PD. There's limitations. We admit that there may be limited generalizability due to the possible selection bias, and we exclude people with severe PD, and there is lots to follow-up rate of about 20. And further investigation is warranted to establish its mechanism of action and long-term effect and sustainability. And talk about sustainability, we would like our patient to have continual practice. So what are we going to do? Is we are going to do an implementation science study about the implementation of a train-the-trainer mHealth mindfulness yoga program for PD. So basically, they received the tested evidence-based yoga program for 8 weeks, and then we will do the train-the-trainer session to train some yoga ambassador, and the patient will let the mHealth assist yoga practice for 6 months in the local community. So why we use the mHealth? Because PD patients often experience symptom fluctuation and they have poor memory. They can't remember the sequence, okay? So we use the mHealth to offer 24/7 access to guide yoga practice so they can have higher autonomy and flexibility to establish their individualized self-practice habit. And also we use the train-the-trainer approach because we would like to have permanent skill transfer and empower the patient, and also save the cost to improve the compliance and sustainability. And for evaluation, we will adopt the WE-AIM framework to evaluate whether this program can translate research into action. How many people do they reach? What is the effectiveness of the program? How many centers adopt the program? And how is the implementation be consistent or not? And how is it maintained? And here is some slide. We are still developing this mobile-friendly web page, but it covers some guide meditation and also pranayama. And there are different videos stepwise approach of yoga asana so as to train their core, their body alignment and posture. So what are our future goals? I think same as everyone here is to advocate yoga as a recognized prescription for chronic illness care and also the rehabilitation globally. I would like to acknowledge the Hong Kong Society for Rehabilitation and also the Hong Kong Parkinson's Disease Association and Foundation. He has come to the last slide, and I'm very happy that our research has received quite positive feedback from the local and international community. And here are some publications in terms of newspaper and news article. And may all of you be well and be happy. And namaste. Thank you.
Thank you, Dr. Kwok. I would like to invite Dr. Binny Sareen to felicitate Dr. Kwok, please. Dr. Binny Sareen is the Regional Director, Global Peace Initiative, Director General, International Peace Initiatives, Honorable Mount Abu, Rajasthan. Thank you, Dr. Binny Sareen. Thank you, Dr. Kwok, for your wonderful lecture. It's now time to introduce our next speaker, Dr. Indranil Basure. He is a consultant cardiologist and cardiac electrophysiologist and head St. Francis Hospital Group, Memphis, Tennessee. He holds a position of professor in cardiology at All India Institute of Medical Sciences, Rishikesh, Uttarakhand. He's a former faculty member in medicine at Beth Israel Deaconess Medical Center, Harvard Medical School, and has worked as an academic physician, researcher, and scientist at various reputed medical institutions, both in the United States and in India. He has been meditating since the age of 6, and he recommends the use of meditation and yoga in modern medicine, particularly in heart diseases. He has been an invited guest speaker at multiple physician organizations, including the Texas Medical Association. With that, now I invite Dr. Basure to deliver his lecture, please. This is the forward, backward. We need to point it that way.
Oh, okay. Point it that way means?
No, I mean, if you point at the screen, it won't change.
Oh, okay. Hey, good morning, everybody. Can I have a louder good morning? Thank you. Let's get the day started. Swami Vivekananda said he needed 12 people to change the world. Can I get some of them up here? Good. Let's have that Josh. We are talking today about a subject that has changed India and put India in the world map. It has changed how medicine thinks, and that's what I'm going to talk to you today about. I'm going to bring to you some of the new research concepts that has come up in the field of yoga. As the excellent lecture Dr. Satbir Khalsa said, you need to have research. You're taking to the West, you meet a cancer director and you tell him yoga is great. He'll give you a good smile, have a cup of tea with you, and then show you the door because there is no proof what you are talking. So since my medical days, we were taught that when you do research, the best form of research is randomized clinical trial. So I'm going to talk to you today about some of the newer things that can replace randomized clinical trial so that we can prove to the world what yoga really is and the different effects of yoga. But before that, let's draw back and think of the question is, why this new yoga in medical sciences? As was pointed out earlier, one of the biggest problems facing medical sciences all over the world is what we know as non-communicable diseases. And the extent of having non-communicable diseases varies between 86% in different places. It could be as high as 92% in Sweden and Finland. And I'll show you some data about India too. So it's a big problem. People sitting out here, how many of you have hypertension, high blood pressure? Good. How many have diabetes? How many have a heart disease? So we still have people, but there's one thing which all of you have. And being a physician, I can make the diagnosis even without seeing you. And that is stress. We develop stress since we are born. That's how human being as an animal grows up. And I'll go through those. And one of the biggest causes of non-communicable disease is stress. Now, you might think, okay, if you're talking about heart attack, if you're talking about cancers, who cares? I mean, India, we have 7 lakh people dying every year due to malaria. We have a few million dying out of TB. So that's not a problem for India. My friends, unfortunately, that's not true. 63% of patients in India have non-communicable diseases, more than one. And the sad fact is that today, suppose you have pneumonia, which is a completely treatable disease, you spend between 500 rupees to 3,000 rupees to get treated. But today, if you have a heart attack, the approximate cost in India to get admitted, treated medically, not without a stent, not with a stent, medically, for a 4 days hospitalization followed by 3-day rehab is 1.6 lakhs. So my dear ladies and gentlemen, brothers and sisters, how many of us can afford that? And in 2020, 2025, we're in 2020 now, in 2025, it's expected that we'll have 20 times the number of coronary artery disease in India than what America has. And there are different reasons to it. I'll not go into that. So it's important to understand that we are on the brink of a disaster if we don't come out with a plan B. Medicine has developed extensively. You have a heart attack, I can take you to the hospital, open up your coronary arteries, but that's only an acute care. And acute care, fortunately or unfortunately, has become a smaller part of medicine than what it was 50 years back. Today, we are talking of giant diseases, multifactorial diseases that kill millions of people. There's an epidemic of diabetes going on. Out of every 4 people in this country, 1 has diabetes mellitus. Out of every 6 people in this country, 2 out of the 6 people have coronary artery disease. They might not have an official heart attack. They might have had a silent heart attack. They might have hypertension. They might have diabetes. They might have a combination of both, which will kill them because of having coronary artery disease. So it is a big problem. And that's where I'm going to talk to you about some of the newer things by which we can prove how yoga works. And that is needed. And that must come from India, because this has been the source of yoga forever. Now, as I talked about stress, medically, we basically divide stress into 3 different categories. What we call is eustress, which is a stress that all of us have. Like, I'm coming to give a talk, I might have a little stress, but that is not damaging. Tomorrow you have an exam, you have a stress. The nice lady who brought me to this place, she said she's a 3rd-year medical student. Next year she's going to appear for her finals. Obviously, a few days before your final, I can see a bunch of students here. You might have stress. But that's a small stress that comes and goes. That actually improves your performance. We, as a human being, our performance is improved when we have this form of stress. Then comes the second form, which is called distress, where you have acute stress. But the acute stress is followed by a prolonged period of stress. That stress, which should not be remaining, remains because of different things which we'll talk about. And that's where yoga lifestyle is important. And the third is toxic stress, where stress is there every minute of your life. The stress could be because where you're working, because your boss doesn't like your face, because you're fighting with your wife, or your children are giving you problems. These are normal things. I mean, when you're born, even if you're a God born on earth, you have to go through these things. Everybody had it. I mean, Jesus Christ was nailed. Vivekananda couldn't feed his mother for a couple of days after his father died. Ramakrishna had cancer. These people can take care of cancer in seconds, but they didn't do it because everybody on this earth has to go through this. The question is, that's why Buddha said, pain is mandatory. You want to suffer that pain, that's on you. That's optional. So today I'm going to talk of those things that you can do using yoga as a lifestyle, where you can make the suffering optional. So the last is what is known as the toxic stress. And toxic stress is the stress that remains with you and goes forever. Now the question is, why at all do humans have stress? It's very interesting to understand why. You must understand that we lived in jungles for over 4 million years. So morning when you don't get up from your bed, you just come out of your cave. The first person you might meet is a saber-toothed tiger or a mammoth. So for 4 million years, you had 2 things to do. You either kill that animal or you get killed. So we as humans, to survive and come to be the predominant species on earth, have developed this flight or fight mechanism. In those few seconds that you saw that saber to the tiger, all your muscles got ready. Your heartbeat went from 50 beats to 60 beats per minute to 150 beats per minute. Your muscles in your legs were filled with blood and energy so that you could fight that animal or run enough so that heat cannot kill you. So this has happened for 4 million years. You may be settled animal today. I call it animal because we are all basically animal. We are just, the difference between animal and us is that how we change our behavior, and the same is the difference between us and God. It's not a separate being. It's you who reaches that end by your behavior. So when you have this, if you didn't have this stress, you would have been eaten up. Your predecessor would have been eaten up. And you and I wouldn't have been in this hall talking to each other. Some other animal would have predominated this place. But the problem is now different. Problem is I and you work together in the same place. You're a scientific officer, I'm a scientific officer. You become the director, I don't get to be a director. So I'm jealous of you. Now, if I was a dinosaur, I would have just gone and eaten you up. But can I eat you up? No. I'm just jealous. So what happens is this causes subconsciousness burning in me. So every morning, instead of damaging you, oh, you've got a good Mercedes and I have a broken ambassador. This guy, he was a failure in my school. See, he's got a big business and I'm begging around in the streets. This causes reaction inside your body and your subconsciousness. So at every moment you're stressed, which you should not be. And that's what toxic stress we are talking about. Now, why, when you have the stress management for stress, the basic story is this. On one side, you have stress created by real situations, and also stress created by unreal situations. Like I said, you have a Mercedes, I don't have, so I'm jealous of you. You are promoted, I am not, so I'm jealous of you. So these are non-essential, but they're still stress. And the tragic part is that human body cannot differentiate between them. Did you guys know this? That's true. That's why one of the important treatment in cancer is called visualization, where the patients are made to visualize the state they were before they had cancer. Because the brain cannot differentiate between the two. How many of you want to go to, say, Rishikesh or Kailash from here now? How many of you can? Tell me, raise your hands. Let's get some hands raised. Okay, cool. At least we have some brave people in this room, man. Maybe we can go, but let's think we can go. Because that's true. If you close your eyes and you think of Kailash, your brain, the picture of Kailash and the feeling, your brain cannot differentiate when you're physically in Kailash or sitting in this hall and thinking of Kailash. And that's a medical truth. Your brain cannot differentiate if you can create the whole environment in your brain. And that's exactly what is done when you do visualization in cancer. So that's what is important for you to understand, that the environment is created by you. You create the environment of stress. You create the environment of unrest. You create the environment in your brain which activates brain circuits that cause anxiety. You cause release of dopamine inside your brain that cause depression. Yes, unfortunately it is you. It may not be you as Ram Sham, but you as the animal who is the human being covering this soul that is inside us. Now the question is, just because you are the creator, you can extinguish them too. And that's where the secret of yoga lies. While the stress is created, what yoga does, it cuts off all the circuit. And I'm going to talk to you some of the circuits. One of the important things that it taught was that you can control your autonomic system when you practice yoga for many years. So when I was in medical school, I said, you must be joking, man. Autonomic system? all the physiology books from top to bottom says they're autonomic. You cannot control them. Till an incident happened in my life, which I don't want to go to details, but you guys can read this. I wrote this everywhere. It's in Huffington Post in the US. Here it is at Daily O, India Today. A man for the first time showed me, who was my guru, that actually you can control your blood pressure and heart rate. There are many yogis who don't come here, who don't spread their name and fame, who don't have a corporate shop to sell yoga. They are hidden in some small caves in Himalaya. They can make their heart flat, straight. They can control their blood pressure, and that's autonomic nervous system. But today's science, after so many years, have understood that that's the truth. That is not voodoo science. Yes, we can control all the so-called autonomic reactions that we have when we have stress. So a couple of years back, I was asked to write an article in a journal about the role of yoga in meditation. So as I said, most people in medicine are fed by some untruths always. So the big fever going all over the world is still there. Now it's slowly, many famous people have spoken the truth, so things are slowly eroding, but it's not eroding that fast because there are some older guys who like holding on to the last bit of twig while they are sinking in the ocean of nonsense. So RCT, there's hardly any RCTs on yoga. And so I wrote an article. I changed. Initially, I thought I'll make it a meta-analysis. Then I said, I don't have enough data to make it a meta-analysis. So I made a systemic review. 2 years back, I was invited by the American Heart Association. As you know, we as a cardiologist, we have to function within guidelines. And the American Heart Association, which is the world's biggest body of cardiologists, cardiac surgeons, cardiovascular scientists, they create guidelines so that cardiologists all over the world can follow those guidelines to treat patients. What will you treat a patient when they have hypertension grade 1, hypertension grade 2, grade 3? So these guidelines are very important. In America, you follow it with tooth and nail. In India, people try to follow it where possible, but still those are considered the basic guidelines that every good clinician must follow to help their patients. So I was one of the cardiologists invited to write this from all over the world. Again, I had the same problem. There were more RCTs than that was in 2014, the earlier one, 4 years back. But now there were more RCTs, but RCTs were like this, which were not bad, but they unfortunately had their problems. They were, give me an RCT in modern medicine with over 3,000 patients, but they had methodological defect, and because of methodological defect, they were given less preference. So we have to understand this, that medicine has been going through this phase because medicine did not want biases. So you had to be scientific, and to be scientific, you had a randomized clinical trial where you were blind to what was there. There were multiple arms, and that randomized clinical trials had to go in a predefined way to make sure that that particular thing worked. But the problem is that doesn't work everywhere. Let me give you one medical example. I treat heart failure patients, people who are going to die in less than 6 months. How many of you think heart failure is better than having a cancer? Can anybody raise your hands? How many of you think heart failure is better than cancer? Okay. The majority does not think that, which is good. Heart failure, my dear friends, is worse than every known cancer. Yeah, take that from me. Every known cancer other than the GI cancers, pancreatic and stomach cancers, every known cancer. A full-fledged heart failure, you live for 6 months. The tragedy is it's such a nasty disease. And in that, there's a trial called the Atlas trial where a particular drug called lisinopril was used in 40 milligram in that trial. And that showed that it improved the life, it improved the lifespan, it decreased morbidity and mortality of heart failure patients. 40 milligram of lisinopril. I can guarantee you, I can take one of those young people in the back, give them 40 milligrams, the blood pressure will zero, they'll fall down here. So we slowly have got to understand that RCTs don't work in the population. RCTs work in a very small population. The trial population cannot be thrown to the normal population. And there are some other problems which we'll talk about. Given this fact, the second fact is most of the problem treated by yoga is subjective. Like if you have depression, I treat you with yoga and meditation, your depression goes away. If the other people does not have depression, has anxiety, his anxiety goes away because the brain is reoriented. There is what is known as neural plasticity. The brain neurons, the circuit are reoriented to get rid of his depression and to get rid of his anxiety. But modern medicine does not understand that for so long. Now they're slowly coming to understand it. Why? Because they have been treating disease in terms of pneumonia and an antibiotic. Now you have pneumonia in Antarctica. And that pneumonia is by Streptococcus pneumoniae type 3 or the pneumococcus. I give you an antibiotic, you get cured. You get the same pneumonia in Bangalore or in Delhi or even in Mars. If you can go to Mars, you'll still be treated and you'll get okay. But that's a different paradigm. You're killing a particular bug. But chronic disease is a completely different paradigm. You're changing the basic pathophysiology by changing your own physiology. So it's not an antibiotic and a particular bug reaction. So, but modern medicine had to go through this phase of randomized clinical trial. Otherwise, it wouldn't have developed to the stage it is now. But now it is time to change, time to understand the complete, as Dr. Khalsa pointed out, we are in a very important stage of the evolution of medicine where slowly we have got control over infective disease. We can treat malaria. They don't have malaria in America. We have to inject monkeys to get malaria and then do experiments. There is no TB. There are only a few people who have TB are those with stage 4 HIV, which even that doesn't happen. There are over 40 new drugs. Last year, 7 new drugs came out for HIV. So you can have HIV people living as long as any normal guys. So those infective days are gone. We are coming into a completely different paradigm, and you got to take modern science and change it so that it gets accustomed to this new paradigm. So stress is something that is subjective. So you cannot use an objective measure like randomized clinical trial. And it's very important to understand that. The more important thing is whenever you have stress, certain group of genes are involved and they are called CTRA. There's a particular pathway called the kappa beta pathway, and a particular set of genes are involved. I don't want to go to the details. The details are here post-talk. Anybody wants to talk to me, I'll be more than happy. So the blood cells in your body when you are depressed release chemical. And those chemical causes genetic changes. And those genetic changes causes for multiple reasons. Important hormones are released like cortisol, norepinephrine in your blood. Your brain chemistry changes. There are release of more dopamine. There's less release of serotonin. So all this happens when you are on stress. And see the fun part of it. You're stressed because your neighbor has a bigger house. And this is happening 24/7 in your body without you even knowing about it. And that's why yoga needs to be a lifestyle, because you don't do yoga, you don't do meditation. That's what my guru once told me. You are in meditation. It's not like going to a gym and practicing some asanas anybody can do. And that's another problem in the US. US, everybody thinks yoga is just doing asanas. No. Yoga is 90% meditation, less than 10% asanas. Maybe even lesser than that. So the question is important to understand that these genes are involved, are activated and cause destruction on your body, causing you heart failure, making you get cancer. Now, does these cause heart disease? Yes, 100%. You can have hypertension, you can have blood diabetes, and that you can have coronary atherosclerosis leading to heart attack. Heart attack will get you stents. Stents will get you diseases which I treat, like arrhythmias. So what do I treat? I'm trained as a cardiologist, but after doing my training as a cardiologist, which is a super specialty, so you train in you do your medical school, then you do your medicine, then you do your super specialty training in cardiology, then you do your super subspecialty training in cardiac electrophysiology. So every person who has stents comes to me because they develop arrhythmias. The biggest arrhythmia happening is atrial fibrillation. There are 12.6 million heart failure in this country, so I am the doctor who puts in the devices to treat this heart failure. But if I am treating this heart failure patient and he's dying of cancer in 3 months, is there any use? No use at all. And that's why this newer concepts are slowly coming, and I'll just go to that in a second. So, but before that, so can the stress cause cancer? There is some controversy about it. 50% of the oncologists believe yes, stress can cause de novo cancer, but we are yet to have molecular mark to show that that's 100% true. In some cases, some cancers it is true, but not in all cancers. But the other dangerous thing is, if you already have cancer, stress can ravage your body. People with cancer who practice meditation, people with this is study done way back in the 80s. People with stage 4 breast cancers, thankfully it's not available. We don't see much today. I don't know the statistics about India. In America, it's almost gone because people are more trained. There are better ways to treat, and early diagnosis is there. However, so these cancer patients are clearly seen when they have stress, when they're not treated with meditation and yoga, they live for 2 to 3 years. And they can live for as long as 12 years when they're treated with meditation and other mind-body changing techniques. So when you have, and we know the actual molecular pathway where the killer cells which go and eat up cancer, how their function is depressed if you have stress. So we know the molecular pathway, we know the genetic changes. So for all practical purpose, every day of the morning, every day of the afternoon, what you're trying to do when you have stress, knowingly or unknowingly, you're trying to have all this disease, and then you want to go and say, oh, I want to stay healthy. Yes, my dear, if you want to stay healthy, the health starts not in the doctor's office, it starts in your mind. And unfortunately, brain is not the place where only stress lives. Stress lives in each and every cell of your body, and its relation is with each and every cell of your body. So this is one of the earlier article by Richard Davidson. Richard Davidson has a huge lab in Wisconsin. He's done a bunch of PET and functional MRI studies on people like Dalai Lama and a bunch of other Buddhist and Hindu monks. So this is what his first day, where he says clearly that RCT doesn't work in mind-body medicine. This is the other important study. Thomas Friedman, he's been one of the Director General of the Center for Disease Control, one of the most respected institutions in America about disease control. He's one of those viral oncologists who has done great work on viruses and how they cause human cancer. His name has been referred for Nobel Prize. He didn't get the Nobel Prize till now, at least. But having said that, this New England Journal of Medicine, he clearly mentions that RCTs, which is considered the gold standard, but by using RCTs as default, you cannot go much. And why is that? So if I have to prove that yoga particular technique works, I have to get a huge number of patients. I can't get 30, 40 patients. I have to get maybe 5,000 patients, 3,000 patients. Teach them yoga for 5 years. Make sure every day they are doing the same yoga. And after 5 years, I might get some statistical significance, I might not. And at the same time, spend ₹1 million to take care that these 5,000 people do yoga every day. Where is that money coming from? Who's going to pay for that? Pharmaceutical companies are not going to pay for that because they want more. You want to be sick because then their drug sells. So we can't use the same old horse to try to do everything. So the RCT is important. You need RCT for certain trials. RCT cannot be the one and end all for everything. And when you try to push RCT for one and everything, you lack the clinical knowledge that is important to understand the disease nature. The nature of the disease has changed, the treatment has changed, and the way you prove the treatment has to change also. You can't use the old horses. And as I said, summary statistics from RCT really represent individual patients. 40 milligram of lisinopril. Give me a healthy guy. I think in my life, I might have not even 10 to 15% people who I give 40 milligram lisinopril. There's another drug called carvedilol, which if you give for 1 year, their ejection fraction gets back to normal. So when you have heart failure, your heart is supposed to pump like that. It pumps very slowly. Your ejection fraction comes down from a normal above 50% to 20, 25, 15%. Below 15%, we call end-stage heart disease, where we can either go for transplant, which is not always available, or doctors like me, we put in a device called CRT, which helps to relieve those and bring them, which are like a replacement for transplant so that the heart comes back to normal. In those patients, can you give for 25 twice daily of carvedilol? You can't. Their normal blood pressure is in the 60s and 70s. So what is the use of having a RCT spending millions of dollars and then not using it on your patients? And it's not I am saying that. These are the guys who are NIH, the National Institute of Health, is slowly understanding that. Because National Institute of Health funds from taxpayers' money. It's not government's own money. So they have to treat diseases, they have to fund diseases which people in America gets. They don't treat diseases with some exotic responses. So it's important to understand that medicine is changing. And that's where you guys, being from an educational institution, have a big role to play. So as I said, now it's a question of precision medicine. Every man is a separate entity. And as I was telling you, last 2,000 years, we progressed massively into molecular medicine and other things. But the problem is, we have gastroenterologists who can talk of what is happening in one liver cell called hepatocytes. But liver doesn't make the man. I can tell you when I put a CRT, every cell of a heart, what they are doing, how they are improving. But I'm just seeing one single cell of the heart. That doesn't make me a great physician. So medicine is now going back and trying to understand that you have to treat the human being. You can't be a Mr. Hepatologist, Mr. super specialist, super into 10 to the power 26 hepatologist, or 10 to the power whatever, and cardiologist. Who cares? There are people who do endoscopy morning and evening. Man, if you are dying in 3 years, what does it matter if you have an ulcer in your stomach? It doesn't matter. So look at the whole human being. It's important to understand that the super specialty has a place in acute care. I'm not saying they're useless, no. But every super specialist must also know the basic of the human being to be a better physician. I can't close he's got eye problems, so let me close my eyes. I only treat the heart. There are heart problems which have eye manifestations also. So you have to have a global view as things have changed. So RCTs are completely inappropriate because, as I said, if you're treating pneumonia caused by pneumococcus 3, RCTs is great. You can sit in Timbuktu, you can sit in the Mariana Trench under the Pacific Ocean, and you treat them with antibiotic, it will work. But when you're treating with a disease like anxiety, depression, heart disease, hypertension, you cannot use the same parameters. You have to use a different parameter for them. So what do we do? What are the different ways we do? And how does it work? So as I said, two things that stress does. One thing is, why is stress so lethal? One is, as I said, it causes a flood of reaction that releases hormone, changes gene, changes your brain, so that your heart, brain, kidney, everything is affected. But that's not all. It causes something else which is even more dangerous. It stops the body's normal police, the normal force to function. It decreases the function of beta cells. It decreases the function of natural killer cells. So your chance to get an infection by a virus, to develop a cancer, or or get infection is increased because your normal body immunity is depressed. So think how lethal is it that every day, for unknown reason, we get stressed out. And every time when we are stressed out, we are damaging all these things in our body. So what yoga does is it neutralizes this response. You have a response when you need it, and the moment the response is not needed, it shuts off all this response. It shuts off the genetic sequences. It shuts off the blood cells, and that's how you go. So the new method that I was talking is called the NN1 method. I'll go through a little bit of it very quickly. So in this, what we do, suppose we have a patient of hypertension. Last year, I was at Apollo Madras. There were more than 500 cardiologists. I was invited to give a talk on one of the conference. So I asked the physicians there, how many of you will start a medicine when somebody comes to you with hypertension? And unfortunately, I was sad to see almost everybody raise their hands. In America, where medical legal is so strong, I don't start a medicine. Everybody who comes to me with stage 1 hypertension, I don't. Because the guideline clearly says, in America, the guideline says, think about India, where you had the 10,000 years of this philosophy going on. First is change your lifestyle. Second is change your lifestyle. Third is change your lifestyle. 10th is change your lifestyle. That's the only treatment for hypertension. First. If they don't respond, you go to medicine. Because you have to understand that today you have 3 medicine, tomorrow you'll have 4. On the 5th day, you'll possibly live on medicine, stop eating food. Because you're trying to fight a secondary cause. You're not trying to fight the innate mechanism inside the body that is creating it. And that's what yoga does. Yoga hits to the basic of the disease. Yoga kills the reason for the disease. Whereas hypertension, treatment of hypertension prevents you from stroke, prevents you from getting heart disease, but it doesn't cure anything. It just controls. And there's a big difference between curing and controlling. Controlling, the side effects of the drugs are there, the disease itself progresses. Whereas cure means you tend to root it out of your body, and that's the difference between when you do yoga for a cure and a drug for a cure. Remember, I'm trained in Western medicine. I did my medicine cardiology in India. When I went to America, I did my medicine cardiology, everything there. And these are not being told by somebody who practices Ayurveda or something else. This is what modern medicine is also saying, that you got to understand the entire gamut of medicine and practice that as a clinical physician and not be like a horse, your eyes are closed. You can only see allopathic medicine everywhere. That's a wrong attitude to take. So in NN1 trial, what do we do? So I take a guy, he comes with meditation. I take a salivary cortisol. I take a bunch of hormones that he has. I find they're all high. Now I give him yoga and meditation for 4 weeks. And then I repeat those tests. Because now we have clear-cut markers like salivary cortisol. We have those genes we know which are upregulated. We have those second and third generation receptors which we know are upregulated. We can calculate those. More science has developed enough. Then you give them the intervention. Instead of taking 10,000 people, making them do yoga for 10 years, spending $1 billion, and then maybe getting a small, not even a small, sometimes p-value of God knows what, which is of no significance. And then everybody in the world tells, oh, you didn't do RCT, so all your study is useless. That's not science, that's voodoo. And if somebody is saying that, we need to change it. And it's time to change that, and some of those can come from this country. So that's how we do those studies now. That's how we are trying to do studies where we take the patient, do the parameters, give them their protocol, follow them up and show these parameters are going down, and that's the way how you treat them. So yoga is the most practiced form of mind-body medicine. 200 million people, and that I think is a very conservative estimate. Seeing Sadhbir's presentation, I think that's in the last, he's absolutely right. In the last 4 or 5 years, has almost doubled the numbers. After yoga day was started all over the world, we possibly have more than 200 million. But anyway, that's a conservative number practicing. So 86% of yoga practitioners in America believe that yoga gives them all this, gives them wellness, decreases anxiety. And there are tons of cancer. There's a whole book of cancer patients given yoga. There's a whole book of hypertension, diabetes patients on yoga, how they improved. And I have given reference to most of those, and I'll be more than happy to talk with each and every of you to give you those references you can read. So it's not like me. And the good thing is, these have not been done by Indranil Basure, because Indranil Basure is an Indian, so I am biased. I like yoga, so I could be biased. These are done by real physician scientists who see patients, who do research, who don't know about India, who has no clue about what the damn thing India is all about. And they have proved it. As you saw, not even a single of my slide showed any research from India. That doesn't mean there is no research. There are tons of research from India. But what I want to point out to this young crowd here is, you guys are studying medicine, you guys are studying naturopathy, Ayurveda. It's your job to prove this, because yoga comes from India. 10,000 years of history comes from India. So my last slide. So we're, as I said, we are standing on the shoulders of great giants, Swami Vivekananda, Maharishi Shankara, Maharishi Arvind. So we need to prove it. And I think, though we have a lot of pathways, last 10 years, almost 3 to 4 Nobel Prize directly, not directly, but indirectly went to the very concept. Some of the yoga concept is like fasting. Gave a Nobel Prize to a Japanese, as you know. Elizabeth Blackburn got her Nobel Prize for showing meditation increased telomerase. I have a slide on that. So I think maybe one of you will be the future winner of a Nobel Prize if you can show that what we have been telling for last 10,000 years has scientific background. So this is the slide I was talking about. Elizabeth Blackburn, she was in Yale, now she's back to UCSF on how meditation can slow aging. And that's important to understand. We have millions of patients having dementia when they are old. They can't remember their name. They can't remember who their son was. They can't remember where their house was. We have no drugs. We have 3 drugs that's as good as useless, like placebo. They don't work. In 2010, Sarah Laser for the first time showed that your brain actually increases in size when you practice meditation. Similarly, in cancer, if you have Herceptin, which is like $100,000, one capsule, it doesn't increase your natural killer cell function, which is supposed to eat up your cancer cell, even 1%. But meditation has shown you can increase the natural killer cell function 150 times the normal. And none of this research has been by India, by people who are biased. They've been by physicians, scientists from all over the world. This is a study in Australia which showed this. So take-home message is, stress-induced chronic disease is an enormous burden on our healthcare. Stress management is a skill that can be honed through mind-body practices such as yoga and meditation. Mind-body medicine has a strong evidence base, and we need to increase the evidence base more. As I said, when we did the AHA guideline, we went through over 4,000 journal articles. That's a huge number. And as the Sadhbir was saying, every morning you get up, you find there are 2-3 new articles coming out somewhere or the other. So there's a huge potential base. And it's time to throw away RCTs where it's ineffective and go for newer means to prove that yoga works. And mind-body is also an ideal candidate because you don't have to spend tons of money doing research, rather than the money can be spent for preventive medicine and making people more healthy. Thank you very much.
Thank you, Dr. Indranil Basure. I would like to request Swami Dayadeepanandaji Maharaj to kindly come over and felicitate Dr. Indranil Basure. He's an MBBS graduate from Davangere Medical College, and he joined the Ramakrishna Order in Belagavi in 2004, and he has a passion to spread the positive message of Swami Vivekananda from all walks of life. Thank you, Swamiji. We would now like to break for tea. I would like to request all the audience to come back at 11 o'clock sharp. We'll have a short tea break, and I would like to request the speakers to take any questions during the tea break itself. Let's thank all the speakers once again.